Situations like Ayesha's happen all around the world. Nearly half the world's population lives in areas at risk of malaria transmission, and with over 228 million cases annually, malaria claims the lives of nearly 500,000 people a year. Currently, with most of the attention of the medical community focused on COVID-19, the malaria endemic is not being given the resources nor the attention that it needs. We chose to focus on this problem and help save the lives of thousands of people. Our wearable patch is the best way to combat this problem. As of now, the only resources that test for malaria are in medical centers, but our product eliminates the needs for traveling to hospitals in order to get a proper diagnosis. This is extremely useful in underdeveloped areas where hospitals have less funding and lack proper medical equipment. Compared to hospital testing methods, our product cuts down testing time by a significant amount by giving results directly to the user in a matter of mere minutes. Unlike existing diagnostic methods, our device aims to implement different techniques, such as the simplicity of a glucose monitoring patch and the efficiency of bioluminescent and fluorescent technology. This will have a beneficial effect on those inflicted with malaria by providing them with the opportunity to begin recovery earlier.
BreakingBlood's goal is to make malaria detection more efficient for those that don't have access to adequate medical equipment. This will help people traveling to remote areas or in places with a higher risk of malaria. Specifically, military personnel are often stationed in high-risk regions such as parts of Africa and South America, making them ideal candidates for our product. These places do not always have proper healthcare resources, making the diagnosis of malaria difficult. Our product is a medical patch that implements bioluminescent technology to diagnose if the user has malaria based on the antibodies present in their blood. Our specialized patch draws around 30 microliters of blood and examines the blood sample through the use of augmented proteins, which have bioluminescent and fluorescent properties. These proteins are crucial because once a target antibody is detected, the artificial proteins will turn a different color. Depending on the color, the patch will determine the presence of the malaria-countering antibody, which provides a diagnosis. This would provide a quick and individualized form of testing for this endemic, and our patch will be affordable and effective in many developing countries.
The Bill and Melinda Gates Foundation estimates that 90% of global malaria cases contracted are in Africa, making it an ever-present threat. This region, specifically sub-Saharan Africa, is where we plan to focus the distribution of our product. Our goal is to distribute this device to travelers as well as poverty-stricken areas so that those who don't have as much money will still be able to test for malaria. We will also be selling our product in airports where travelers will be able to pick it up, as well as pharmacies and other local medical centers. Military personnel situated in Africa or other areas with high malaria cases will also receive patches to make diagnosis simple and efficient. By implementing user-friendly light technology in a compact patch, our product can be used anytime and anywhere, eliminating medical center visits to determine a diagnosis. More specifically, we are aiming to create a cost-effective device that gives users a simple diagnosis, which alerts them if they test positive for malaria. This will be a viable option in third world countries compared to existing current expensive options.
To maximize our distributing abilities, we created a graphical representation of our wearable patch. Our technology is similar to the patch used by diabetic patients. However, instead of administering treatment, the patch draws blood to test it. Here are the layers to our patch.
To start, blood is collected through microneedles and filtered through a plasma separation membrane, separating the red blood cells from the blood plasma. The now colorless plasma then passes through to the substrate layer, picking up the substrate furamazine. The blood then mixes with artificially designed proteins, designed to specifically target malaria antibodies. The artificial protein is made up of a luciferase enzyme and the fluorescent compound protein. The biochemical reaction allows for the solution to change color when in contact with these antibodies, using a process called bioluminescence resonance energy transfer, also known as BRET. When in contact with the enzyme, a specific series of amino acids unique to the protein called epitopes will bind to paratopes, a similar series that is specific to the antibody. This reaction will separate the compound protein from the substrate, causing it to turn blue. If there are no antibodies present, a unit attached to the artificial protein will keep the compound protein from separating. However, the force when the protein encounters the target antibody is much greater than that of the unit holding it together, forcing it to split. It takes 1 minute for the reaction to fully take place, after which the color shown will indicate if malaria antibodies are present in the bloodstream. Blue means malaria positive, and green means malaria negative. The complexity of our patch also required a detailed plan of how to allocate money.
Our main focus on funding is obtaining grants through the Small Business Innovation Research Program. Specifically, we aim to obtain grants from the National Institute of Health, which encompasses roughly 90 to 95% of the Small Business Innovation Research budget, and is the largest investor of public biomedical research in the world. In phase 1 of this funding program, around 13% of the companies which apply went up to $225,000. In addition to this monetary gain, this association with a well-known government organization would not only broaden our audience of potential investors, but this partnership with a government organization would help us obtain government contracts, specifically our plan to collaborate with the government to distribute our product to military personnel. Outside of this, we also plan to acquire financial aid from private investors and venture capitalists.